Good evening. Please take some time to review this presentation as a review of our program. You will need to advance to a slide and then advance again, and you will hear the audio component. So it takes 2 advances to hear the audio component. I hope this will work for you. Thank you. Good evening. I'm Erica Nelson. I'm the Residency Program Director. I hope you had a great time with the residents at the social, and I'd like to spend this time reviewing our program. First, a little bit about me. I've been in Springfield for over 24 years and the Program Director for more than 15. It is the best part of my job as an academic OBGYN. I thoroughly enjoy working with the residents. My other priorities are my family. I have 2 children who are both in graduate school, as well as 2 Weimaraners who we love to go adventures, hiking, and exploring. SIU School of Medicine is primarily located in Springfield, Illinois. The first-year medical students spend time down in Carbondale, which is 3 hours south. The residency is primarily out of 2 community-based hospitals, Springfield Memorial Hospital and St. John's Hospital. In addition, the OBGYN rotate to Jacksonville Memorial Hospital, which is 45 minutes west. SIU does not have its own hospital, so it works out of these 2 hospitals in Springfield. St. John's has the perinatal center. It is a Catholic hospital, so we tend to do more of our GYN cases at Memorial Hospital and especially do our sterilization procedures. Jacksonville is more of a rural hospital, does not have a robot, so the residents get a lot of experience with gynecologic cases, especially laparoscopic ones. We also have an outpatient facility that the residents work with, which we call the MOB, that is attached to St. John's Hospital with a walkway, so making it very convenient. The Department of OBGYN also has other outpatient facilities around the Springfield that the residents might participate in clinics. The SIU faculty comprised of, in Springfield, 10 generalists. In Jacksonville, there are 4. We also have the subspecialists in MFM, UroGyn, GYN-ONC, REI, and minimally invasive surgery. The residents also work very closely with 16 community OBGYNs from Springfield Clinic. There are a large number of SIU medicine faculty in all the other specialties that the residents work with, as well as they rotate on other services. We are a fully accredited residency for 4 residents per year and no citations from our annual evaluations. The population that we serve is primarily in Springfield and the surrounding communities, whereas Springfield can be more urban and the surrounding communities are very rural farming communities. We also have a diverse immigrant population from various areas across the world, leading to a very diverse population that the residents care for with very complex medical challenges, leading to excellent education. The overall structure of the resident rotations: in the first year, the residents are primarily working with low-risk obstetrics and outpatient gynecologic procedures, including laparoscopy and hysteroscopy. Towards the middle of their first year, the residents are getting involved in more cesarean sections and more complex obstetrical procedures, as well as operative procedures. The off-service rotations include time in the ICU, in the emergency department, and internal medicine. Moving towards the fourth year, there's more gynecologic experience and subspecialty experience as the residents work on their surgical skills. This is an example of what we call the quilt. It is the rotations that the residents do, with the first years on the right, fourth years on the left. This is last year's quilt because our current quilt is a little bit more complex because we have 5 fourth years. But as you'll see, the first years start off with the first month, as well as the second years doing what we call a round robin, where they're getting introductions to all the services, including OB, triage, GYN, and our weekend and off-service rotation, what we call IM weekend path. During the IM weekend path rotation, this resident does OB on Saturdays and Sundays, and does 2 Stork clinics, as well as spend time on internal medicine, half a day with the pathologist, as well as half a day doing ultrasound. The other first-year rotations include time in the emergency department, as well as time on oncology, in addition to their GYN and OB rotations. Second year also starts out with a round robin to get used to MFM and the night rotations. Second year is probably the most vigorous year because of the night call and MFM rotations that set them up well for their third and fourth year. They also spend time in the ICU and on REI. We have an ambulatory rotation, which is what it sounds like, mostly ambulatory, where they're doing prenatal clinics, referral clinics, vulvar clinics, and colposcopy clinics, and also attend the bone clinic. During third year and fourth year, you'll see there's now more time on GYN services and the subspecialties, including GYN, urology, and REI, and a lot more time on GYN to be able to get the surgical skills that they need. There's also time as the OB senior resident. We do have curriculums that run through the 4 years. The first one is ultrasound, which starts in the first year on the IM weekend path rotation with a half day in ultrasound, starting with learning how to do BPPs, AFIs, and growth scans, and then transvaginal ultrasounds. This continues on their REI rotations and GYN rotations, learning transvaginal ultrasound, and on MFM and OB services, working on their OB ultrasound skills. In addition, they have the ability to sit down with an AIOM certified ultrasound reader to go over ultrasounds for interpretation. The first-year residents spend time with the pathologist looking at gross and microscopic pathology. We have the reproductive health elective, which includes our electives, our introductions to contraception, as well as working at Planned Parenthood for caring for patients who desire elective termination, both medical and surgical. In addition to working with patients who require hormone therapy. We do have a billing and documentation curriculum for all 4 years, going through the proper documentation and billing. We have an excellent coding department who reviews these documents with the residents and gives them feedback. We also have a robotics curriculum. Robotics curriculum is offered to residents who desire to have the ability for robotics. We have not had difficulties with having residents obtain numbers to get certification at privileges at the institutions for employment. Our curriculum includes the web-based modules using the simulators. We have backpack simulators at both hospitals, and there are consoles, dual consoles at both hospitals, and the residents get a high number of cases that they are the primary surgeon in the console, over 50. So it's a very strong curriculum for those residents who desire these skills. These are the statistics for the graduating residents. I do not have the numbers for 2021 to 22. They have not been published by ACGME, but when I reviewed them at the time of graduation, they were pretty close to these numbers for the previous year, except that our numbers for abdominal hysterectomy had significantly increased. But as you can see, there are plenty of numbers for the residents, both in operative procedures as well as gynecologic procedures, and getting a well-rounded opportunities. In addition to the subspecialty clinics, the generalists have their own interests and specialty clinics, including a bone health clinic, colposcopy, vulvar disorders, breast disease, in which they work with a surgical oncologist, pelvic floor therapy with nurse practitioners, and a sexual health clinic. All of these clinics are available for the residents, and they rotate through for their education. All the residents are required to participate in patient safety and quality projects. We put together projects every year that are presented at our institution quality symposium every spring, and also at national meetings, including ACOG. As you can see in pictured, were the two projects that were presented this past spring. The residents also serve on committees, including the quality committees for the department, for both labor and deliveries, and the GYN quality committees. The residents participate in patient safety drills on labor and delivery, as well as in our outpatient facility. If we have an outcome that needs further review, the residents participate in root cause analysis, and they do get white belt training for Lean Six Sigma. The residents are required to complete one research project during their residency. For preparation of this, we have journal clubs, which we hold 8 times in the year at a faculty home where we review primary research. We also have didactics on how to complete a research project, and we have a very strong research team led by PhD faculty. So for the required project, at minimum, it needs to be presented at the SIU symposium, but we encourage them to present their work at national meetings. And in fact, these pictured here is Dr. Hausch and Dr. Shavla presenting their work at the Central Association OBGYN just a couple weeks ago in Charleston, South Carolina. And once it's presented, we also encourage them to publish their work in peer-reviewed journals. We have significant mentoring experiences for the residents. All of them are assigned to a faculty member when they start the residency program. Certainly they can change their mentor if it's not working out for them, but also they get mentorship with their research projects, their quality projects, or if they have a special interest, such as wanting to pursue a fellowship. The residents are significantly involved in the teaching of the medical students on labor and delivery, in their prenatal clinics, during GYN surgery, and they participate in what we call the Residents as Teachers Symposium during their first and second year to give them skills for teaching. The clerkship director, Dr. Zano, gives them feedback on their teaching skills. We do not have them have students in their continuity clinics or second and fourth years, as they concentrate on taking care of their own patients and their own learning. Orientation for residency is almost a year-long process. We start early with the first month with our round robin, making sure that they are comfortable with the services. Every day for the first week, they meet with the program director or another faculty member to go over didactics, as well as go over requirements and things that they need to know about. A lot of the learning and orientation is on service, as I believe that doing is the best way to learn. So orientation is pretty intense for the first month, and then we also move then towards having weekly meetings with just the first years, which over several months then graduates to just monthly, where we concentrate on a journal club of articles that are specific for first year learning, so practice bulletins and other literature articles that pertain to prenatal care and basic gynecologic care. Duty hours, the residents complete timesheets, and the average is 65 hours per week. Undoubtedly, there are rotations where they push closer to 80, and then other rotations where it is much lower, such as REI or ambulatory. But with our structure with call, the residents do not go over the 80 hours. They get their 1 day in 7 off, as well as their vacations. The residents participate in continuity clinics during the first years. It is our prenatal clinics, which we call stork clinics. So they are learning a lot about prenatal care. Our population tends to be pretty high risk, so they're getting great education in prenatal care and obstetrics. Second through fourth year is primarily GYN clinics with well woman care, as well as complex gynecologic care. If from these clinics a patient is identified that needs a surgical procedure, the resident is responsible for their preoperative workup, surgery, and postoperative care. And dedicated time has been set in the rotations so that the residents are able to take care of these patients and do their surgical procedures. We find that continuity is extremely important. We do offer all forms of contraception in our clinics, despite being affiliated with a Catholic hospital. If we have to do a sterilization procedure, we can do that through Springfield Memorial Hospital, but we do lots of LARC sterilization, and we do work with Planned Parenthood for patients who have other needs, period. This picture is from our Halloween, and that is the Department of Contraception. The residents are supervised. We have in-house call at both hospitals every night, as well as attendings in the clinics and in the operating room. We do evaluate the residents for levels of autonomy, giving them more ability to do procedures and activities on their own. We encourage the fourth years to bring an underlevel resident to their procedures so that they can have the role of the teaching physician to increase their skills. The resident call schedule is put together by one of the senior residents. We have a night float system where we have 2 residents in-house at all time. The second year is responsible for labor and delivery at St. John's, and the third year is responsible for the gynecologic patients, the subspecialty patients, and labor and delivery at Memorial, where there's a lot fewer deliveries. We do have a home call person just in case it's very busy, and they are available to help out with post-op checks and admissions when it's very busy and in that transition between the day team and the night team. The first year residents shifts are only 16 hours long. They do not do any 20-hour shifts. This started when there was the ACGME rule for first years not doing more than 16, and we've just continued it because we felt it was better for education. Our educational curriculum, our primary time is Fridays from 8 to noon with protected time from clinical responsibilities. We have divided up the Fridays, where the first Friday we do M&Ms, second Friday we do preoperative conference, and third Friday we do interesting cases. And fourth Friday we do research and quality projects in the first hour. The second hour is devoted to grand rounds, and we have speakers from a variety of places, international, national, from SIU, and every year each resident is responsible for doing one grand round presentation. We follow this by didactics, and we have a curriculum that we go through that includes the subspecialties, ultrasound, and GYN. On the first Friday of the month, we do have a surgical skills curriculum with simulations where we use the MCLI, which is a state-of-the-art surgical skills facility, and we do sessions concentrating on laparoscopy, hysteroscopy, abdominal hysterectomy. We've had cadavers, SIUOBGYN procedures, colposcopies, forceps, vacuums, etc. In addition, each rotation has their own educational curriculum and readings that they go through at the time of rounds. Preparation for the ABOG board examination includes our curriculum. All the residents take the CREOG examination every year in January, and they do participate in the mock CREOG that is provided. We also do a mock oral examination in February where we have a kind of a miniature oral examination. So by the time the residents graduated, they have had 4 experiences with the mock oral exams. We do have a question bank through TrueLearn. Most of the time they're CREOG type style questions, but for the last 6 months they switched them to ABOG type to prepare for the boards. We have faculty that do a Wednesday review session 1 to twice a month. And then, of course, there's individual learning and reading. If needed, residents can participate in a review course, and we do have a 100% pass rate for over 3 years. The residents take the fundamentals of laparoscopic surgery during their 3rd year, end of October, early November. We have the trainers, the modules, and preceptors to help prepare for that. In addition, the Surgical Skills Lab is open at all times for them to go in and practice, and we've had 100% successful completion of this exam. We take wellness very seriously every day, checking in with each other, but we do devote time on the 5th Friday of the month to do activities, whether it's putting dedicated time to go do appointments or participating in yoga or painting, ceramics, going on a field trip, a variety of activities. In addition, we have looked at rotations that have maybe a half day of downtime, and we recommend those times for getting appointments. The residents participate in a retreat every September. We find that's a good time where the first years have adjusted to being in Springfield and residency, and it's early enough in the year for them to work on team building, getting to know each other, and overall just having a good time with each other. We also participate in the ACOG Wellness Week, which is the second week in February, and we participate in the different activities and themes that ACOG suggests. And this is a fun week, which we do with the entire department, including the nursing team, the secretarial team, and administrative team. So it's a good time all around. Physicians are leaders, whether it is within their practice, in the hospital, community, church, etc. So leadership skills are important for the residents. They all have administrative duties when they're a fourth year, and they are expected to manage the day-to-day details and problems and issues that come up. We also provide some training by sending the third years to a chief camp that is put on by ACOG. It's been virtual. We hope that next year that it'll be in person because it's a better experience. We've had residents that are participating with the ACOG with leadership position, and currently Savani Alaru is vice president of the junior faculties for the District 6 ACOG. And so she's getting a great experience. Electives are offered in the third and fourth year. One of the GYN blocks can be used for an elective, whether that is to get more information about fellowships or just looking into a special interest that we do not offer here, or a global health elective. All those opportunities are now available and in full swing. We had a little bit of a break in electives due to COVID, but all of those restrictions have been removed. We are fortunate to live in Springfield, that's the capital of Illinois, and so we take advantage of being able to participate in advocacy activities, whether it's going to the Capitol for lobby days, or if there's a bill that's being presented, going and testifying. In addition, we participate in the lobby days in Washington, D.C. with ACOG. We have officers within the district, and we participate in the events with Planned Parenthood. The residents participate in community service, whether it's with their own individual interests, as well as working with the students as they go at least monthly to one of the women's shelters and bringing food and giving an educational topic. In addition, twice a year, a group of residents, along with a family medicine resident and students, go to the high school health classes to talk a little bit about sex education and contraception. And that is an educational experience for everyone. The residents are evaluated with a 360-degree evaluation, where they're given self-evaluations, the nursing teams, by the faculty, with procedures on the competencies and the milestones. All of these evaluations are collated and reviewed by the Clinical Competency committee twice a year to give formative and feedback to each resident. After the clinical competency committee meetings, we have formal meetings with the program director twice a year to review the recommendations. We also have a dashboard that we use. But I have an open door policy. If I'm around, I'd love to chat and work with the residents and mentor. I work closely with the residents on labor and delivery in the clinic, in the operating room, and I really enjoy working with them closely and getting to know them better. This is a sample of the dashboard and the information that we keep track of, that review at the formal program director meetings, so that we're keeping track of all the data that is collected so that we can review in a huge summative way the resident progress. Some of the perks of our residency program is 3 weeks of vacation. That can be 3 full weeks, or it can be 2 full weeks and then 1 week with 2 days of vacation and another week with 3 days of vacation to split that third week up. In addition, the residents get 1 week of educational leave each year. The first years tend to use that to take step 3. The fourth years use it to prepare for the boards. Other things that the time can be used is to attend meetings where primary research is being presented. And there is money to go to meetings. There's enough money to go to one big conference or maybe a couple of small conferences. The residents also have a stipend for reading materials that can be used to help with their education. Anytime there feels like we need to make a change or solve a problem in the program structure, I heavily rely on the residents to help me solve these problems. Ideas have come about changes in the call schedule, home call, Friday nights sign out. In addition, when we had to do COVID platooning, they helped with those schedules to figure out how it was going to work best. We are right now working on getting our reproductive health elective revamped. In the past, we had a provider that the residents rotated with, but she retired. Then we had COVID, so we were kind of stopped, and now we're getting it re-going again. And in January, the residents will be going to Planned Parenthood, and the fourth-year residents have been instrumental in helping me put together that schedule. I rely heavily on the residents to help me if there's any changes that have to be made. So the strengths of the program, of course, are the people, the residents, the faculty, as well as all of our support staff. We get great support from the institutions and SIU to put together a very strong educational program. And of course, we have the complexity and diversity of our patients that the residents care for, all contributing to a very strong educational environment for the residents. The weaknesses, of course, we can always get more written feedback, and we are being very innovative in trying to help the faculty and providers quickly and easily be able to write down the feedback they have for the residents. The residents get quite a bit of verbal, but it does need to be written down. The other weakness, I think, is that we have 3 EHRs that the residents need to master. We all know that the EHRs are one of the major leaders for burnout, and so we are very aggressively trying to look at ways to make interacting with the EHR easier, faster, more efficient, while giving us the information that we need. So where do our residents go when they graduate? Some go to fellowships. About 1 every other year goes to a fellowship. And in fact, we currently have a resident who will be attending an MFM fellowship next year. The residents who graduated in June are all going into generalist positions. 1 joined us. A second will be joining us in January. 1 is with Duke, 1 is in New Jersey, and 1 is in Chicago. So they end up staying local and going throughout the country. This gives you an idea of where the residents have gone for their jobs, and as you can see, it's a wide variety throughout the country, as well as some fellowships. A resident who desires to do a fellowship and sets themselves up well has no problem getting a fellowship in the field that they desire. So putting it all together, I along with the rest of the faculty, believe that we have an extremely strong residency program with great training in obstetrical, gynecologic, and subspecialty care for women. And the residents, once they finish the program, have the competency and confidence to be excellent OBGYN providers. And we are very proud of our program and our residents. I look forward to meeting you all tomorrow. Even though it is virtually, I'll be happy to see your faces. Hopefully you enjoyed the social and this review. Please bring your questions. We will have time to answer questions before we start our interviews tomorrow morning. I do follow the ARIS rules when it comes to communicating with candidates, and please do not expect any communication from me. All of you have been chosen because we believe, based on your record, that you would be an excellent candidate for us and would be able to succeed in our residency. And we're using the interviews to get to know you better. We appreciate your thank you notes, but understand that they will not impact your ranking. And any post-interview communication, if you have questions for the residents or for Carol or myself, you are more than welcome to email us, but this communication will not impact your ranking. We will communicate a follow-up if there are any changes to our program or any updates, but otherwise, please do not expect any communication from us. We hope to gain all the information that we need from your application and your interview tomorrow. So I look forward to meeting you tomorrow, and please bring your questions, and have a great evening. Thank you.